Everybody in? All right. Well, welcome everybody. I'm really excited to be able to share this information with you today. We've got Dr. Yoon, and what I've asked Dr. Yoon to present is focusing on the QCam and everything that we can do with that camera. There's so much that the QBLISS system can do that I think sometimes we get overwhelmed and lost by everything. So what we're hoping to do is in the next few episodes is kind of focus on certain parts of the system. And today we chose the QCam just to get started. Now, I'm not going to take up a lot of time, but I'll just tell you, and then we'll fill in as we go through this program, is the QCam is, I think, something that I really enjoy using in our practice. When you have an aesthetically focused practice, Dr. Yoon's going to show how we can do some amazing simulations today to help motivate our patients, to help them understand what's going on. So it's not only for biofilm. And I think that's the important message that we could take away today. So Dr. Yoon, I'll let you get started. And again, I'm looking forward to learn everything you're about to show us.
Thank you, Michael. I am very happy to introduce the QCam, the function and link dance, the new function. So I will start introducing the how to use the QCam Pro, and then move to the simulation, and then so actually you can see the how to use the QCam Pro image with the link dance function. Okay, so
that's gonna be perfect.
Yeah, let me show you. Can you see?
Yes, I can see it now.
Okay, yeah. Today I want to introduce the functions and the purpose of the QCam Pro device through the clinical cases. Yeah. Sorry, what is next? So, in the United States market, actually 4 types of the device available. Among them, I think the most important actually the device is QCam Pro. So you know why? Actually QCam Pro can screen the entire oral cavity, like the panoramic X-ray. You know the difference between the panoramic X-ray and the bite-wing, the same. The QCam Pro, the mean is a bite-wing, the panoramic X-ray. QCam is the role of actually the periapical X-ray. So every day with my dental hygienist, I followed a 5-step workflow called the red biofilm care to manage the oral biofilm and improve the diagnostic accuracy. The concept is very simple. From the professor gives the research, measure the pathogenic biofilm older than 3 days to show the red fluorescence. So following this concept, and then actually to allow us to identify the harmful the biofilm and manage high risk area the more effectively. This is my case. First step is the screening. So he visited me the last year, the April. That patient returns every 4 months for regular biofilm management. You can see some red biofilm, right? So in the regular image, we can see the tooth brushing has not been sufficient. So in the gray image, we can see very easily the large of the red fluorescence from biofilm, older than actually 3 days. And then the black one is actually the staining. From the smoking, and he really liked the wine. And after wine, during the wine, he enjoyed the smoking. So the very heavy actually the staining. So then step 2 is evaluation. We can make the plaque index automatically. As you know, I have the bad memory in the dental school. My professor told me, Dr. Yoon, please calculate the plaque index, but actually there is no line, no area, but just imagine how to make the plaque index. But our the incidence function, plug index is automatically calculated by analyzing pixel level information and measuring the proportion of the red fluorescence relative to total area. So higher score mean is actually the poor oral hygiene management. In this image, the maxillary right retinal incisor show 39.1. Actually show the worst score. And then our system showed another graph. Sometimes actually the graph is much better. Area with the pathogenic biofilm appear red, while the clean area appear green. So showing that the image can be more effective than presenting numerical value. So, and then he returned to me 4 months later, the last August, okay? Then we start a comparison function. It's very, very useful to educate patient and to motivate patient. So left side April, right side actually the August. We compare results from the actually two images, and then you can see the many of the red area observed during the April visit were reduced by the August visit because of the education, right? Brushing, yeah. So then also we can calculate, and then we show the score, different score between the April and August score and graph. Okay, let's see. The upper area is a score, the lower area graph. Someone prefer score, someone prefer the graph. That is the reason why the Linkdance provide actually both of them. And then this one is before scaling, this one is after scaling. And then we make actually the slide after scaling like that. Then in this image, this slide function allow us to immediately recognize how much improvement after the biofilm care has been, yeah. So then I explain. Now I can explain the crazy line anterior, the area. Before the biofilm control, on the crazy line, the biofilm and staining. So we can distinguish, we can make the precise actually the diagnosis. That is the reason. Before diagnosis, we should remove all of the biofilm, and then actually we can make the precise actually diagnosis. And then he realized he had the crazy line on the anterior, and then he confessed I had the bruxism and clenching. And then we take the image by using the frequency like that. The large of the crazy line, large of the crank line, and then some, can you see the carriers of fraction? And then actually I recommend the Botox, and then I recommend the night guard. Yeah, so that is the protocol. So 5 step, the protocol, I said, the red biofilm care. This is very, very useful. We can provide the patients with the clear explanation of both of the biofilm, the care result, and the actually treatment plan. Yeah, that is the reason why I said the most important device is QACAM Pro. This is a powerful advantage of a QACAM Pro. And then let's move to the T cell here. So this is carriers. Very sad, actually the image, very young, children. So after the orthodontic treatment, he didn't visit my clinic for actually 4 years. And then already he had the severe carriers. So on the carriers region, there about the biofilm, already biofilm enter into the actually dentin area, and then they make a very strong red fluorescence. This is a white spot area. I am actually maintaining this patient for last 6 years with the fluoride toothpaste and actually regular visit for the biofilm care. So sometimes, the early white spot regions are not displayed in the red, but rather in the brown or the gray tones. And then we can apply the fluoride or the remineralization gel. The Remigel is, I really want to use Remigel in Korea soon. Yeah. So then I want to compare the image after using the Remigel in Korea. So, and then this one is the proximal carriers. First step, we take the QACAM Pro image, right one. And then we found the red area. Then I explain to the patient, okay, there is a red area. The first three will remove all of the biofilm around the teeth, and then take the image again by using CREPAN-C. So CREPAN-C result to the left side. And then very clearly, we can make the precise diagnosis. You have the proximal caries. Another case, this is a curate CAMPRO image. We can see like that. And then in the actually blue image, we can see the little bit difference between the actually other area, two area, right? And then I recommend the X-ray taking to the patient. Then patient accept after looking this area. Without this the image, patient reject. Dr. Young, why I take the X-ray, and then but after see this area, and then we take X-ray like that, and then we can make the precise diagnosis, the proximal caries, and then he allowed me to remove the red area. Okay, open the enamel. We can see very strong the biofilm from the dentin caries, and then step by step, we'll remove little bit, remove, take again, like that. This is the proximal caries, the clinical case. Now let's move the anterior crazy. So lots of patients has actually crazy, right? Because actually elderly people, after receiving the implant treatment, they visit me for regular checkup for 20 years. And then after 20 years, and then actually they have the actually crazy line. But we can see crazy line, but we don't know how serious, how severe crazy line is. And then I showed this image. Can you see there's a red fluorescence? That means actually between the crazy line, there is a real, physical, actually the gap exists, and then bacteria, biofilm enter into that space and then make the crazy line. So this is also the treatment. The patient around the bracket, we can see large of the biofilm. So we don't need any disclosing solution to show the biofilm. Only one photo is enough to show the biofilm. This is very actually nice image. I like this one. One image show crazy line, white spot. Can you see the actual regimen? So even implant patient around the crown, around the implant, we can show large of the biofilm. Yeah. That is the power of the CAMPRO screening function. So before start treatment, we need this kind of screening information, not just for that day. So this is asset. This is asset. And then in the near future, we can use this image for comparison. Yeah. So this is the advantage of the CAMPRO. Yeah. Thank you for listening. Yeah.
And so when you have this information, you can engage the patients even better, which helps to retain the patients in your practice. So this is a great practice builder because they can see the biofilm. If you've got a lot of biofilm at the gum line, you're more likely to get gum disease or periimplantitis. And if you've got a lot of red in between the teeth, you're more likely to get the decay. And so that score you're able to give the teeth, the percentage of red on its surface area is nice to see. It's very nice.
Yeah. So that depends on the actually amount of the biofilm. I decide actually interval of regular checkup. In any textbook, I didn't see. Yeah, what is the real interval for regular checkup? But actually, dentists say, okay, 1 year, 6 months. What is the evidence? But actually, create CAMPRO image to show the evidence how to decide the interval. It depends on the amount of the biofilm. Sometime actually I give the three months interval. Sometime I give the 4 months interval, 6 months interval, 1 year interval. It depends on the amount of the biofilm. That is the evidence-based interval decision. This is my idea. Yeah.
And I think something else to emphasize before you go into the simulations is all these photos that you showed, when we use the QCam to grab those images, it goes very fast. Once you're used to taking the photos, you could take a full smile, a lateral right, lateral left smile, and then you just put retractors in and do the same. And so it just takes a minute gather this information using the camera. So it's very nice. And if you haven't used it, the camera will focus, and then when you hit the button, it captures the white light and the red light image. So you know it's both at the same time. So it's not going to be like you're doubling the amount of photos you're taking. It's just the normal photos you would take, and so it makes it very convenient.
Yeah, I know. Actually, that is the new device. So sometimes actually dentists and hygienists very confused to use this device. But actually, from my experience, we need some training. Can you guess actually we gave the lots of the time to the X-ray in the school student decision, right? So we needed some effort to make the better image. So training and experience and the training. Yeah. Then actually we can make the better image.
Correct. Well, it's just like if you brought in a camera to take aesthetic photos of someone's mouth, you have to train somebody to do that, or you have to be good at doing that. So this is the same, but now you get that evaluation plus the biofilm, which is, I think, much more valuable. It's more motivating.
Yeah.
So yeah, the next part of this, Dr. Yoon is going to go through some simulations that you can do with the LinkedIn software, which just blows me away. So I'll let you kind of jump into that, because again, I know some of you have this equipment already, but it can do a lot more than just detect biofilm. And I think this next half of this program is going to really enlighten us all.
Okay, I will show you this one. Okay. Just a moment. Sorry.
No, that's right. It's looking good.
Yeah, this one.
Yeah, and if anybody has any questions, you can hit the raise the hand icon or submit a question.
Yeah. Can you see this one?
Yes. Yep.
Yeah, this is the real ring dance image. So just a moment. Yeah. Okay, today I will show the two simulation. First one regarding the making report function. Okay, let's start this image. Okay. She is actually my patient. Now she stayed in the United States, and then she visited me for regular checkup with her mom while visiting her home in Korea. So we can see this one, okay, some red one, and then I will recommend the biofilm X-ray. Can you see this area? Okay, so
Yes.
yeah, this area. So we can see some carriers here. So and then we take the the fancy image like that. So then this is tagging function. We make like that, some box like that, and then this is carriers. So CBO, right? Okay, I'll let you show the another area. Okay, this is carriers. Okay, then already they recognize the teeth, and this is carriers. Okay, then watch that. Fit and Fisher silent like that. Severity, okay, moderate like that done. Yeah. Then so we can make a report for her. So create a report like that. So and then information to the what image I want to add, this one and this one. Okay, so and then confirm. Okay, then my actual AI function make a generate to the LLM model, and then hello Dr. Yoon, not Dr. Yoon, the patient, and then we can explain you have what kind of problem and what kind of treatment plan you need, and then we can add so some image. So I want to show the image to the parent. So then I want to add like that X-ray, and then this one, okay, this one, confirm. And then my AI system recommend the infographic automatically. This is the cavity form. This is Korean word. So this is a sealant, but it's Korean. So we will prepare the English version soon. So like that, and then we make the print report. This is the report. Can you see that one like that?
Yes.
All information I want to share to the patient, then we can make this kind of image. Also, I want the send this information like that text. Then can you see the my image?
Yeah,
my cellular phone. Yeah. So same result. I can receive the cellular phone and QR code, and then actually application. That is function of the so there is a function of tagging and the making report function. And then move to the another function. This one is the my patient.
We have one question.
Okay.
Dr. Jung, do you want to ask the question now?
Voice, Dr. Jung, mic. Mic, please.
No mic? Okay. Maybe type the question in if, yeah. Okay, you can type it in. I think the mic's not working. So Dr. Yun, why don't you go ahead and do this simulation?
Yeah, okay.
So
and this one is actually the diastema patient. He want me, he wanted to ask me, Dr. Yun, what is the type of the treatment plan? And then I explained, okay, there are two types of the treatment. First one is actually the resin direct filling or the partial laminate like that. And then, we can see simulation. This is the resin filling or the partial laminate, and then save session. Okay, go to the original image, and then this one is a laminate case, the full laminate. Okay, so full laminate like that, and then simulation. Then our AI system provides three types of the result. So then actually the patient and I choose which one is better. This one, and this one. And then my patient and I prefer this one, third one. Okay, then this is the third one. And then save session. And then go to the compare function. This one is the laminate case, right? So this is original image, but, and then this one is a laminate case. Yeah. So, and then I can compare left side. This is direct resin filling, and right side actually laminated veneer. And then the patient prefer the left side, and then left side and first, and then actually for using this one, and then 1 or 2 years later, and then our treatment plan is that actually we make the full laminate area, laminate treatment, upper 6 and lower 6, like that. Yeah. So then he want to see the result of actually 6 the laminate and 6 laminate in future. Yeah. So in future, this is the treatment plan. In future treatment plan, but actually nowadays he and I agree about only the direct resin filling like that. So this one is actually the first simulation case. Second one, I want to show the gingivectomy function. Okay. She also want the aesthetic treatment, the anterior area. So preview, go to the preview. Okay. And then 4 crown and 4 crown like that without any gingivectomy. And then simulate. Also, first case, second one, third one, like that. Yeah, this is first again. But actually, can you see some, the difference level of the gingiva? So I recommend actually gingivectomy here. So, but she didn't understand meaning of gingivectomy. So, and then I save this session, and then go to the original image, and then move to the shave adjustment function, fill and remove. Okay, so this one is actually the right add. Then simulation. Yeah, so I want more. Okay, like that. This is the after gingivectomy. Then she understand. And my goal is that at the level of gingiva, like that, I want to make the same level of gingiva to her. Then actually to move to the simulation after gingivectomy, like that, and then simulation again. So case one, case two, case three. I prefer the second one. And then, we the save session and then go to the compare. So this is before and then after. So she's satisfied about actually gingivectomy treatment. And then I show before gingivectomy like that, after gingivectomy like that. So we decide upper for laminate and then the lower for the laminate. So now actually I'm waiting the final the veneer crown from my lab, and then I did the gingivectomy like that. After explanation by using the simulation for to patient, and then patient can understand actually what is the meaning of the gingivectomy. Yeah. So this one is the simulation case. Yeah.
Mm-hmm. And then one other thing you could do is you could just do a whitening simulation too, right? Without
Yeah.
or anything like that. So if you take the picture of the smile, you could whiten the teeth, and the LinkedIn software AI will give you an idea. So,
Yeah.
Going to the question, just to be sure, Dr. Joan, that you got the answer. It says you got the Q-ray pen. Does a Q-ray pen work the same way? And I know that the response came back that with the Q-ray pen, because it's like an intraoral camera, you can't get the full face shots or the full smile shots like you can with the Q-Cam Pro. But the way that you use the platform, the LinkedIn's platform, and sending reports can be very similar. It says, see, our main goal for now is to detect invisible crack lines. So as long as that can be achieved, yeah, we're happy for now. Yeah, it works. The Q-ray pen C works very well for that. Just today, we had a patient, tooth number 31, so the second lower right molar. Patient's been having sensitivity on that tooth. So we used the Q-ray pen last time the patient was in our office, and we showed him the crack and advised him he needed a crown. He, at that point, wasn't ready to do a crown. So this week he called up and said, that crack you showed me, it's gotten worse. And so we did just like Dr. Yoon would do. We took the pre-op photo today to show the patient where the crack was. Then we removed the old restoration and then took another photo, but this time with the biofluorescence, you could see where the crack was running through much better than you would with the white light image. And the patient really understood what we were up against, that there was a crack going distal to mesial on that tooth, and that's why he was having the symptoms that he was having. So being able to have that intraoral camera view with the biofluorescence in that case works out really well. So, you probably bought the Q-ray pen because you knew the biofluorescence properties and its crack detection, as Dr. Yoon was showing. But the QC, and I think down the road we will talk about the Q-ray pen, just like we talked about the Q-Cam Pro tonight. But the advantage of the Q-Cam is just we use it in our office. So when a patient comes in, we will take those frontal photos in the smile, the right lateral, then in left lateral, the retracted, And then as Dr. Yoon was showing, the maxillary-occlusal, mandibular occlusal, and that gives us a place to start with our patients just for the diagnosis, because now they can see their teeth on the big screen. And even if it's a white light image, now they can see how dark the teeth are, where the cracks are, where the dark fillings are. And then you convert that to the biofluorescence image. So now you can show them that, where they're most likely to develop problems down the road. And then today, what Dr. Yoon was showing in the second half is, you can do all these different simulations. So if a patient says, yeah, you're right, my teeth are dark, what would they look like if they were lighter? Now we can use this AI to lighten their smiles. And then if they are interested in perhaps doing veneers or restorative work or composites, then we can actually do a simulation with that too. And even taking away gingiva and doing a gingivectomy. So what I want everybody to leave with is that I know when I looked at AIOBIO myself, I was looking at the biofluorescence technology with the intraoral camera and the imaging it could do with the white light and the red light. But today with LinkedIn, you can use this software to engage the patients. You can send them reports. You can do simulations, and it can do so much more. And remember, it's not just like Dr. Yoon was showing us today. It's not just showing them where the red is, but actually putting a score, quantifying, okay, how much surface area of that tooth is being covered by the red. And so it becomes much more, I think, understandable for the patients. And now they're engaged. It's not just there's a bunch of plaque there. Now they can see the red. And every time they come in, they're going to want to see their score get better. And I think that's the biggest advantage, that we can offer our patients today something to really help them understand, which motivates them. And then once they're hooked, they're going to stay with our practice. So that's going to be a good thing.
Yeah, right. So another my opinion is that actually Cray pen is very, very nice device for detecting the cray line and carriers. And then also the reactive treatment is actually the perfect situation to use Cray pen C. And then also the LinkedIn can provide the tagging service for Cray pen C. They take the image Cray pen C and then tagging, and then you can see the report with the Cray pen C image with the tagging. So, and then you want to expand the patient more the management. Then actually you need the Cam Pro, and then Cray Cam Pro absolutely give you more opportunity to start the conversation with the patient.
Mm. Yeah, no, that's right. And Dr. Jung, he was just mentioning that he's waiting for a security team to approve. Yeah. So, yeah, we understand that. That's good that they're doing that and that you got good security. But yeah, once you get the LinkedIn's installed, then that's where a lot of the fun begins.
Yeah.
All right.
Thank you for using the Cray pen, Dr. Jung.
Yeah, that's very good. Well, Dr. Yoon, did you have anything else to add? I know we're down at the half hour, but I think you did a wonderful job. Thank you very much.
Yeah, thank you.
They're a PDS supported office. Oh, that's great. No, that's great. I hope with PDS, I hope they watch your office and you do well so that PDS wants more, because I think that'd be great if you can introduce it. Yeah, they hope so.
Mike, what is the meaning of the PDS?
PDS is one of the biggest DSOs in the United States, and they're
really
very progressive. They were one of the first ones to have lasers and hygiene, CEREC machines, and things like that. So they're a very progressive DSO.
Yeah, Dr. Jung remained a very nice message for all of us.
Yeah. So we hope you sell them, and please let us know if you need any help or support, and we'd be glad to help you out or explain it to the PDS, the people that have to make the decisions on whether to introduce it clinically or to make those types of purchases. We'd be glad to help them to do that. I think one of the things to understand is some of the Korean research has shown, and it's some of the slides that Dr. Yoon at some point will go through how to improve your practice, but the time it takes to explain the clinical situation of the patient actually goes down because you're showing them images that are more meaningful to the patients. And then with that, the revenue actually goes up. So I think that's something that PDS would be interested in. If they can be more efficient, communicating more effectively, and then seeing the revenue go up, DSO or private practice, that's all what we need, as long as we're doing something good for our patients. Yeah. So yeah, if you need anything, please let us know.
Yeah.
Yeah. Well, with that, I just want to say thank you to everybody who was able to attend. This again will be recorded, and so I know there'll be many people watching it in its recorded version. But Dr. Yoon, thank you very much for your presentation. Dr. Kim, thank you again for being here, and we look forward to next month, where what I've done is I've asked Dr. Kim to explain even more what the red shows. You know, so the red is a biofilm, but one of the questions that we're often asked is, well, you know, there's good biofilm and bad biofilm. So what are we seeing and why? And so I just heard Dr. Kim give this presentation this week, and I asked him, could you repeat that for us? Because I think it's a lot of the insight that like PDS or anybody evaluating this equipment wants to know really what they're seeing. And that's what we'll talk about next month. Okay.
Okay.
So thank you very much.